Ladies and gentlemen, actually I was not going to hold a speech because my counterpart in this, okay, thank you. My counterpart in this, Eddie Sutrisno, is on the organization sheet, and he should have this talk. For reasons that I will explain to you in the coming 15 minutes, he chose to stay in Medan. And I'm going to tell you about our joint venture. The idea was to have two universities and try to establish a plastic surgical training facility backed up by the university, the Erasmus University, and settled in Medan. So we were training the residents in Indonesia. Training on the spot, which I think, and I think I'm not alone in that, is the best way of training doctors in low-resource countries. Now, Indonesia is not a very low-resource country, but it's a huge country, and there are, next to Jakarta, still a few spots that need our help, and the help of their own doctors. Now, I'll go through a few things of this program. Oh, sorry. Why should you start a plastic surgical training program in Sumatra anyway? I mean, are there not other doctors that are more needed? Are there not other diseases that needs attention? Why should you, for crying out loud, treat or train plastic surgeons and treat plastic surgical patients? Well, now, Sumatra, and we are talking about this one island, yeah? Indonesia has 17,000 islands. This is one island, Sumatra, has 4,000 kilometers of coastline. If you put it on Europe, the whole of Europe is gone. Yeah, to give you a slight idea how big this country is. 250 million inhabitants. I think there are 250. Probably 300 million. Nobody knows exactly. Yeah, oh, sorry. So, Sumatra has 48 million inhabitants. They have a birth rate of 80.2 per thousand and an incidence of cleft lip and palate of 1 in 600. This is very high. And there is a thesis luring already here. If someone of you thinks, oh, I'd like to put some effort in there, then your PhD is on the board here. Find out why. It counts for 1,245 new cases each year. There are, at this very moment, 12 plastic surgeons active in Sumatra. So, if they all do what they have to do, they have to operate on 100 lips a year. But you first have to find them. And they won't come to you, because it is costly. If you remember that you have a coastline of 4,000 kilometers, then to have your baby or your son or daughter treated, you have to sometimes travel for a whole day. Who's going to pay for that? And then you're coming in a complete other area of the island. There are 4 distinctive different languages spoken on this very island. Yeah? So you don't want to go there. You don't know anyone. We calculated there are still 30,000 people with cleft lips on Sumatra alone. So there's still an enormous reservoir. This man came to us 1 year ago. And the head of the rehabilitation center said to me, Jan, his daughter-in-law doesn't want him on her wedding. Because she said, Dad, if you're coming and you're on the picture, We don't make the picture because you look dreadful. So then he came because he waited 63 years. He had no money. And no money in Indonesia is no access to surgery. And you see what happens. This is 3 weeks after the operation. 1 hour work for us. Just another reason to start a plastic surgical training. There are 15,000 new cases of intraoral carcinoma in Indonesia. There are only 100 plastic surgeons. That is 1 surgeon in 2.5 million inhabitants. So there are more plastic surgeons in London, in the Greater London area alone, than in the whole of Indonesia. The preferred treatment is combined therapy, oncological resection of the tumor and reconstruction, because they never come at stage 1. They come at stage 3/4. So that radiotherapy alone is not enough. When they said to me, plastic surgery, that is beautifying beautiful people already. So, and where's the money? There's a lot of money in cosmetic surgery. So everyone wanted to become a plastic surgeon. I said, no, 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 no. Plastic surgery is not about Hollywood and Bollywood. Plastic surgery is about the battlefields of the First and the Second World War. That's the place where it was born. Now, I said, I don't ask the government of Indonesia to start a war to provide us with war casualties, but we don't need a war. The war is outside. If you open the door, you see the war. It is traffic, Maidan traffic. It's war. They have more than 5 to 6 cases every day in the big teaching hospital where we were. And only 12 plastic surgeons. Due to malpractice of kerosene sellers who are mixing petrol and kerosene, because petrol is heavily subsidized by the government, it's easier to come by and cheaper than kerosene. So they mix it. And if you mix kerosene and petrol, you get a sort of combustion situation. If you put fire to it, it explodes. I have never seen in my whole life so many flame burns as there. 20 to 40 every month. In Maidan alone, plastic surgeons are confronted with 10 to 20 cases of severe burns, up 60% to 60% every month. 60% burn. Oh, sorry. Operated by Dutch and Indonesian plastic surgeons. We did a pedicle flap to release the tin. Well, they said, okay, we want a plastic surgical training facility at Maidan to help us out. So please, Jan, would you come and organize it for us as a liaison between the Erasmus University and USU, University Sumatra Utara, the University of North Sumatra in Medan. So we went on a 4-week journey in 2011, and we flew all over the islands, and we saw the Ministry of Health, the Ministry of Education, Medical and Dental Board, chairman of the PARAPI. PARAPI is the Dutch equal of the Dutch Plastic Surgical Society, chairman of the Concilium, the rectors of the USU, the deans of USU, the deans of UIS, the University of Indonesia, which is settled in Jakarta, and Jakarta is what Paris is to France. It is the head of everything, yeah? So, this was the progress of the program. You see, they love paper. So, we were signing an MOU. We were signing an MOA, Memorandum of Agreement, and another Memorandum of Agreement. The USU signed an official letter to open the plastic surgical training. Then we went to the KKI Medical and Dental Board. We planned visitation by the Indonesian Medical Council and the Plastic Surgery Collegium. Finally, the definite letter of agreement to open the program study under the guidance of UE on the 1st of January 2014. Hooray and hallelujah, we just opened the bottles of champagne and we said, we did it. First postgraduate training facility between two universities in Indonesia. Never happened before. Start of the training of the plastic surgical training. You see here, even kijken hoor, waar zit dat liggen hier? Klaas Mark, well known in plastic surgical Holland. He is the one who established NOMA surgical program in Africa. This is the rector, and this is my counterpart, Eddie Sutrisno, plastic surgeon in Medan. So he said, okay, now what is the deal? Why are you? That is something that also happens there all the time. I don't know a country which is so obsessed by eating. Sudah makan is something that is, before they even ask who you are or what your name is, they say, Sudah makan. Sudah makan. Have you already eaten? Start of the training program, January the 1st. So, we said 6 years training, it's the same as in Holland. 2 years general surgery, 4 years plastic surgery. Model structure of the curriculum, they have a modular structure. We said, okay, we do the same. We are not going to change that. Acceptance of 4 residents per year, 3 to 4 times a year, a guest lecture for 2 to 4 weeks, depending on the module topics, and yearly examination and knowledge and skill progress. Well, so far so good. These are the teachers involved in the transfer of knowledge. You recognize certain people here, and Professor Hovius and Professor van der Horst, Mick Kreuder, Professor van Zuilen, well, the lot. A real good faculty of teachers, all experts in their own field of knowledge. They were all signing letters to me, said, yes, we want to come. This is, for instance, the way we are. This is the way we are trying to establish lectures with the USU in there. It's the format. Future plans were established e-library between the Erasmus University and USU. We said a satellite rotation of plastic surgical residents at the Harapan Jaya Rehabilitation Center and Harapan Hospital. That is where we were actually starting this plastic surgical program. Skills laboratory at USU University Hospital, and the funding of travel expenses for medical professionals. Well, what have you? Now back to reality. Because this is, if I had said to you, well, this is it. Goodbye. And keep in mind, we are doing something very good over there. No. We are now 1 year further. There are still no residents. Don't ask me why, but they are not there. And the reason is, I have not the foggiest idea. It is holed up. And that is something you have to deal with. You come, you're now in, you see, they say, yes, beautiful, fantastic, great effort, go on. And then when that part comes, suddenly it all goes down and it comes to a standstill. No one wants to take responsibility for it. Has everything gone through the right channels? After 4 years, they are going to ask me now. Yeah, they didn't ask me when I was there. So, USU University Hospital was finished in 2010, but due to lack of funds, has not opened yet. Hai and I went there, beautiful hospital, not a bed inside. There are no funds facilitating the traveling of teachers from abroad, and the coordinator for education in plastic surgery is blocking the training at USU for reasons unknown to us. He has just said, I don't want it. Finished story. 4 or 5 years of work down the drain. I think if you look at all the casualties and all the people who should, who reservedly need plastic surgical reconstructions, there should be a general feeling of urgency. I mean, they don't get any younger. Yes, I'm already there. Well, before you kick off on a journey like this, the direction of which we move should be clear to all participants and the stakeholders where we went through that, the medical board, Ministry of Education, Collegium Plasticus Chirurgum, the whole lot. And it turns out that even after 4 years, when everyone says yes, 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 they mean no. Don't say no, because no is an affront. You say yes, no matter what you mean. Yeah? So that is something that you have to learn. And you have to learn the hard way. Be sure that the counterparts are qualified teachers. That's something that they found out when we started in the 1st of January 2014, that only 2 were allowed to lecture. The other 4 were not qualified. They never told me. So, residents don't get a salary but have to pay a heavy tuition fee. That was something else. When you speak to general practitioners and to young medical doctors, they all seem very eager beavers. So he said, okay, if I have them, I can teach them. They are willing to learn. They ask questions. They like us. And then what we get are the rich and famous, the families that can afford a $100,000 for the training. And they're not interested in you. They will become plastic surgeons anyhow. If they sit down there for 6 years, they will get their paper, and otherwise they buy it. And there is a certain sense of rivalry between the 2 isles, Java and Sumatra. You have to know that as well. I found that out the hard way. After 3 years, then they said, we will never allow Sumatra to have a plastic surgical training facility. Period. Yeah? So, the road to success. After 5 years of patience, hard work, and perseverance against all odds, I don't know the road to success. But I sure as hell know the road to failure. Try to please everybody. So what we now have done is, we said, we will come again if you have done your job. So maybe it works. Maybe now this sense of urgency comes. But Hai and I, we were both very skeptical the last time we went there. And we said, I'm not quite sure whether this will work. But I don't know another solution. So we are trying it this way. Thank you very much.